all about synovial joints. First, we will examine the differences between synovial joints, fibrous joints, and cartilaginous joints. Synovial joints allow for the articulation of long bones within a fluid-filled cavity. They are classified as diarthrosis joints, meaning they can move freely. This also means they are weaker. The adjoining bones in synovial joints are covered in articular cartilage. The bones are separated by a joint cavity and enclosed in an articular capsule. The joint is lined by a synovial membrane. Fibrous joints provide protection for internal organs. They are either synarthrosis joints, which means immovable, or amphiarthrosis joints, which means slightly movable. Adjoining bones are connected by dense fibrous connective tissue. There is no joint cavity. Cartilaginous joints form the growth regions of immature long bones and the intervertebral discs of the spinal community. They are either synarthroses, which means immovable joints, or amphiarthrosis, which means slightly movable. The adjoining bones are connected by cartilage. There is no joint cavity. Here is a visual representation of synovial, fibrous, and cartilaginous joints. Next, we will look at the structural characteristics of synovial joints. Synovial joints have a joint cavity, which is the space in between articulating bones. The joint cavity contains a small amount of synovial fluid. The articular cartilage is a type of hyaline cartilage that covers the adjoining bones. The articular capsule is composed of two layers: the fibrous layer, which is composed of dense irregular connective tissue, and the synovial membrane, composed of loose connective tissue. The articular capsule encloses the joint cavity. The synovial fluid is a viscous fluid that acts as a lubricant and reduces friction within the joint. There are three types of reinforcing ligaments. Most of the reinforcing ligaments are thickenings of the fibrous layer of the articular capsule. Then there are extracapsular ligaments and intracapsular ligaments. There are also sensory nerve fibers that detect pain, and joint stretching, and blood vessels that supply the synovial membrane. Finally, there are articular discs, also called menisci. This will be touched on in the next portion of this video. Joints also have some accessory structures that fortify the joint and reduce friction between the bones. There is menisci, which are pads composed of fibrocartilage which cushion the joint and reduce wear on the bone surfaces. There are also fat pads, which absorb shock and cushion the joint, ligaments for support and strength, tendons that attach to muscles around the joint, and bursae, which are pockets of synovial fluid that cushion areas where tendons and ligaments rub. There are different ways to classify synovial joints. There are non-axial joints where there is no plane of movement, monoaxial joints which allow movement along a single plane, biaxial joints which allow for movement along two planes, and multi-axial joints that allow for movement along multiple planes. For non-axial joints, there are gliding joints, which are joints with a flat or slightly curved face and provide limited motion. For monoaxial, there is pivot joints, which provide rotation only, and hinge joints which move in an angular motion along a single plane. For biaxial joints, there are saddle joints, which consist of two concave faces that are straddled, and ellipsoidal, also called condylar joints, which allow for motion on two planes and have an oval articular face with a depression. For multi-axial joints, there are ball and socket joints, which have a round articular face with a depression. Here is a visual representation of the types of synovial joints previously mentioned. Now we will look at some real examples of synovial joints. On the left side, we have the intercarpal joints. These joints are non-axial and have a gliding shape. In the middle, we have the elbow joint. This is a monoaxial joint with a hinge shape. On the right, we have the atlantoaxial joint, which is monoaxial with a pivot shape. On the left of the screen is the first carpometacarpal joint. This is a biaxial joint with a saddle shape. In the middle is the radiocarpal joint, which is also biaxial, but has ellipsoidal or condylar shape. On the right side is the shoulder joint. It is multi-axial and has a ball and socket shape. Synovial joints allow for body movements to occur. Body movement occurs when muscles contract over diarthrotic synovial joints. Flexion is a movement that decreases the angle of the joint and reduces the distance between the two bones. It generally occurs in the sagittal plane and is a typical movement of hinge and ball and socket joints. Extension is a movement that increases the angle of a joint and increases the distance between the two bones. It is the opposite of flexion. Extension can exceed the anatomical position. When this happens, it is called hyperextension. Abduction is the movement of a limb away from the midline of the body. This occurs along the frontal plane. Abduction is also the movement of fanning your fingers or toes to be spread apart. Abduction is the movement of a limb towards the midline of the body, along the frontal plane. It is also drawing the fingers and toes together. It is the opposite of abduction. Circumduction is a combination of flexion, extension, abduction, and adduction that results in the circular movement of a limb. Rotation is the movement of a bone around its longitudinal axis without lateral or medial displacement. Medial rotation refers to rotation towards the medial axis of the body. Lateral rotation refers to rotation away from the center of the body. Pronation is the movement of the forearm from an anterior or upwards facing position to a posterior or downwards facing position. Supination is the movement of the forearm from a posterior facing position to an anterior facing position. Dorsiflexion is the movement of the ankle joint that lifts the foot so that its superior surface approaches the shin. Plantar flexion is a movement of the ankle joint where the foot is flexed downward, such as standing on the toes or pointing the toes. Inversion is a movement of the foot in which the sole is turned medially. Eversoon is a movement of the foot in which the sole is turned laterally. So what are some of the clinical concerns regarding synovial joints? One concern is arthritis. There are many forms of arthritis. One of the most common types is osteoarthritis. Osteoarthritis occurs when there is gradual damage to the joint, resulting in the thinning of the articular cartilage. This thinning causes more pressure on the bones. The joint responds to this pressure by the overproduction of synovial fluid, causing inflammation and swelling. Gout is another form of arthritis. It occurs when there is an excessive amount of uric acid within the body. It most commonly affects the metatarsalphalangeal joint of the big toe. And finally, there is luxation and subluxation. Luxation is a dislocation of the joint which causes damage to the articular cartilage, ligaments, and the joint capsule. Subluxation is a partial dislocation where the bone is partially pushed or pulled out of place.